Hello and welcome to MAT for Me, Muscle Activation Techniques for the Human Body. My name is Michael Massinelli, and today's video is about the free MAT evaluation. The purpose of this eval is to identify neurological weaknesses that may be creating your compensations, creating your pains, or creating your tightnesses. So first, I'll ask you some health history questions to find out what may have led you to your complaint. What injuries or surgeries have you had? What stresses do you have? And when does it hurt? Yes, when does it hurt, not where. Because where does not tell you anything except for what's getting all the stress. So again, I want to know, when does it hurt? Since when will be a better indicator of positional weaknesses and where to possibly start. Now to find out where to start, I'm going to ask the body a couple of questions to find out what's wrong via a range of motion exam and some timing tests. Because the body does not lie and is not deceived by feelings. Now, depending on your situation, we probably will start in the area of complaint, but keep in mind that everything is connected, so we may wind up going to something that's seemingly not related. And remember, the foot bone is connected to the ankle bone is connected to the knee bone to the hip bone, and so on. So just because you have a pain in your knee doesn't mean the issue is with the knee. It could be muscles in the foot or up in the hip, or muscles in the other leg that are not working, creating the stress that you feel, or the pain, or the tightness that you feel in one joint. So I'm going to start with simply asking the body, can you do the same thing on one side as you can on the other? At the beginning, this range of motion exam will be more active range of motion, having you turn in, or having you do the thing I'm asking, and then comparing it to the other side. So for example, can this leg turn in as far as the other leg? If so, great. But if one leg turns in a lot and the other one turns in a little, well, now we have a limitation. There's something on this leg that's not turning in the same amount as this one. So we'll go through different positions and check turn in to turn in. Are they the same? If so, great. We'll go to the next one. If not, well, that leads us again to what is limited, which here in a second will lead us to what's not working. And once we've identified the biggest asymmetry, assuming it's not too painful, I'll start asking the body, or at least all the muscles that contribute to that motion limitation, another question. Does the signal that tells the muscle to contract get to the muscle in time to stop it when asked to respond? If so, then we'll move to the next muscle. If not, then we will focus on that area. It's all about timing. It's all about the response timing, not muscle strength. We don't care how strong you are. Can you stop? Can the muscle get the signal to contract when asked to do so? Period. Now the timing issue will only be identified when the muscle is in its shortest position. So you see the muscle and the muscle spindle, the thing that tells the muscle to contract, should always be able to communicate or with each other no matter how long or how short the muscle is. But if you've overstretched the muscle or overstressed it, whether it's a chemical stress or a physical stress or an emotional stress, then the muscle spindle may have a gap in it when it's in the shortest position. Now this delay keeps the muscle from doing its job properly, therefore creating instability that lead to your compensations, your pains, and your tightnesses. Once a weakness is identified, one of two techniques is used to jumpstart the muscle, either a low-grade isometric with the effort of shortening the muscle even more, or a muscle insertion palpation. The goal is to get the spindle back online with the muscle. Once the spindle is doing its job and gives stability back to the body will let it move, which means everything that did test strong in the limited motion earlier, we'll have to go back now and recheck everything if more motion was created, because now muscles are shorter. And again, that's where the neurological weakness will show up. It's when the muscle is in its shortest position. So here is an example of a timing test. I will put you into a position and then give you the command, ready, stop me. So on stop me, I'm going to try to pull your foot for this test from here to here. Your goal is to not let me move you. So here is ready and stop me. If it responds immediately, then it's a good test. Then we would move on to the next muscle. If, for whatever reason, when I say stop me, it gives a little bit, well then the signal getting to the muscle is not getting there. Therefore, that is the instability. And that weakness is what's creating the need to be tight. And then again, we'd use either the low-grade isometrics in this position and other positions that surround it possibly, or the muscle insertion palpation for this particular muscle. So it's a very general process and can be done for anyone from the ages of 4 to 104. The evaluation and each MAT session lasts about an hour. You can come dressed in work or workout clothes, but no skirts please. And if you're under the age of 18, then a parent or guardian must be present. So if you'd like to set up your free MAT evaluation or attend one of my No More Muscle Tightness seminars, you can visit my website, matforme.com, and click on the free eval/seminar link for times, dates, and locations. Or you can email me directly at michael@matforme.com. If you are out of the area, then you will be redirected to an MAT practitioner near you. Thank you.